your hosts, Dr. Elizabeth Sage Epstein.
And Dr. Kunal Om Goel.
Amazing.
Yeah.
So let's get into the reason behind this podcast. So can you think about a time when the importance and value of your health was just crystal clear? Like those moments where you are waiting for a biopsy result, or you hear about someone who tragically died all of a sudden, or you have a family member or a friend who got sick, and you suddenly just have this clarity about how precious being healthy is. You know, all those other silly worries in life kind of go to the wayside, and you realize, oh, I would do anything to just stay healthy like I am now. And then you move on and you forget, and you go on with your life and you go back to those silly worries. But I think this podcast is a moment to kind of center and think about, you know, get back to the feeling of that moment where you have that crystal clarity about what really matters most. And one of the things that really matters most is health and wellness, and having this amazing opportunity to live each day.
Yeah, no, that's exactly how I see this podcast. You know, we, of course, are doctors, so we're having conversations with patients all the time about, you know, their health, chronic illnesses, you know, what's plaguing them. At the same time, there's so many moments in my own life and with my friends, not in medicine, where I'm realizing, man, I really would love to optimize in so many ways that I haven't thought about, you know? And
yeah. We both see patients, we're both doctors, and I think we both were drawn to prevention because I think medicine can kind of take away people's power sometimes. Like you're going to the doctor, okay, I've got to wait, I've got to, you know, finally get an appointment, I've got to take whatever medication they recommend, have whatever procedure they recommend, and then my life is going to depend on that. But realizing that actually what you do for yourself day in and day out in terms of your lifestyle actually is way more powerful than anything a doctor can give you in terms of a medicine or a procedure. And so I thought that was so empowering and exciting, and I wanted to share that with people.
You know, we see so many different aspects of patient care that may not be always formally taught or understood yet. And it's become very humbling for us to connect over all these aspects of medicine that we're starting to have a better understanding of, that are so important. And that's what's really inspired us. It's what inspires the conversations we have informally with each other and our friends in the field.
We're excited. And I think, you know, like Kunal mentioned, this is something we like to talk about amongst ourselves. We like to share this with family. We're really coming at this from a humble perspective where this is knowledge. You know, we don't know everything.
Yeah.
We have taken a special interest in prevention and wellness over the last decade plus and studied it. And we love to talk about it. We love to share this information with our patients, but also our family and friends. This is the stuff I tell my family and friends because I love them and I want them to live longer and be healthier. I don't want them to suffer. And so that's kind of where we're coming from. We're sharing it with you all as if you're our family and friends.
Yeah. You know, what we really wanted to do is emphasize, you know, what is it about a doctor-patient relationship that we love so much? And that's sort of what, you know, this podcast also reflects. And it's really coming from a place of humility, understanding, working together. You know, we don't know everything, like Liz said. You know, we're trying to figure all this out together. We're learning, we're humble about it. And ultimately, what inspires us is truly love. It's love for our patients, love to, you know, towards the field, towards deeper understanding, and really just allowing people to improve and do what they love, you know? So that's the whole motivation by this podcast, by our love for medicine, you know, what got us into it in the first place. That's really what I feel. Yeah.
Yeah. It's almost like facing your fears too, because, you know, as a young girl, I was really afraid of the hospital. Actually, I had to pass the hospital to get to my grandma's house, and I couldn't even look at it because I was just so scared of medicine and doctors and everything. And I think people might feel that way about cancer or dying of a heart attack. It's so scary. And I think it's because it feels like you have no control over it. And it goes back to how precious living every day is. But the cool thing is that there's so many things we do have control.
Yeah.
We really have control. And we wanted to point out a little bit of data that kind of highlights that, just as a little appetizer for some of the things we're going to talk about on this podcast. But, the top 2 causes of death in the United States, number 1 is heart disease. Number 2 is cancer.
Mm-hmm.
And one study in New England Journal, which is going to be linked in the show notes, examined over 55,000 adults. They looked at the interplay of genetic risks for cardiovascular disease and lifestyle risks. They found that among those with a high genetic risk, a favorable lifestyle was associated with 46% less coronary events, less heart attacks.
I mean, it's insane to understand, how, we always visualize or conceptualize genetics as playing such a big role, this idea of nature really having a huge impact, and it can make you feel powerless, like you're saying. But this idea of actually having the ability to do things about your health in our work. Yeah, it's incredible, right? Like you get to, just by being mindful of all these other areas of life that matter in your lifestyle, in how you carry yourself on a day-to-day basis, you can change, things that we didn't fully understand before,
Yeah. Exactly. I mean, the fact that you said that too, another really interesting point is that life expectancy in America is actually declining for the last few years in a row. And there's evidence that America's children will be the first in the nation's history to live shorter lives than their parents. Another crazy, really humbling fact. And yet, there's data that medical innovation and the benefit we can get from mortality from medical innovation has actually plateaued. And the additional benefit we're going to get is going to come from what the individual can do for themselves, the lifestyle.
No, I mean, that's something that we've been constantly reflecting on, and it makes so much sense. Of course, these tools, we've seen how technology has progressed and allowed for increased access to the current treatment modalities, to providers through, say, telehealth, through things like AI, through telemetry and outpatient monitoring. I mean, we've seen advancements in the past 20 years that are just incredible. At the same time, there is something to be said about mindset, about understanding, not just that access and capabilities are what matter, but your actual will to do certain things and carry yourself in certain ways, and change your habits and your lifestyles to discover what is best for you to allow you to live your fullest self. That is something that the field is starting to recognize is perhaps as important, if not more important.
Or even maybe perhaps the field is remembering, because this is not something that's new. People like Hippocrates have famous quotes about this in history. Back in 400 BC, Hippocrates said, if we could give every individual the right amount of nourishment and exercise, not too little, not too much, we will have the safest way to health. So, I mean, it's incredible, the innovation we have, and we're so grateful for it, and it does save lives. But how amazing is it that it's actually going back to basics and realizing the power of your own lifestyle that has the biggest impact?
Yeah, I mean, I see integrative as just medicine without ego. We are, and in medicine, you have to acknowledge that ego is the enemy. You cannot have an ego in this field. You have to just go towards whatever the best approach is. So when a patient comes to me and tells me, they want to spend time with their family, that's their most fulfilling desire in their life, but they have certain restrictions or they have certain barriers that doesn't allow them to. I want to be able to offer all the tools in the toolbox possible to get them to their goals and what they love to do.
A real essential aspect of this podcast, especially when we're talking about wisdom that could save your life. That's a big promise.
That is a big promise.
But we're going to be very evidence-based. We're going to provide you the citations and the data on different aspects of your life that can prolong your life. And we've seen that in big studies. And so everything's going to be very closely tied to the evidence. And that's going to be important as we move forward.
We want to make these actual doable steps that you can feel empowered to take on in your own life. Sustainable, doesn't cost an arm and a leg, something like mindfulness, like breathing. It's free, and it's something that everyone can do. And the evidence is demonstrating how much improvement it can have. And a lot of the times it's just people don't recognize how important it is because physicians weren't taught how important it is.
And so we've had to kind of go outside of that, do training in integrative medicine, focus on those studies that are abundant, actually.
Right.
To have the knowledge to be able to make these recommendations with confidence. And that's ever evolving.
Yeah.
There was a lot of back and forth on eggs, for example.
Right. Yeah.
We have to keep reading and know what the latest data is. And it may change.
Totally.
We're humble. We'll wait and see what happens. But so we've had an extra passion for this knowledge. We did not get it in med school.
Exactly. Yeah. And I will say, I don't see any physicians ever pushing back on diet, exercise, sleep. All of those physicians would love to educate their patients on it. I really see it as just a lack of knowledge and understanding and a lack of training on it. And also part of the system is you only have 15 minutes to talk about, whatever's going on in a patient's life. So it seems just very difficult and unrealistic for doctors to focus on it. But what we're understanding is, man, how important it is to talk about this stuff. We really can't let it go,
Yeah, and we've changed our lives a lot through training, I think, and really put these into practice. And, we're going to be addressing mental health aspects as well, because good mental health can save your life too. So we'll be kind of getting into a wide range of topics.
Yeah, perfect. Well, Liz, why don't you tell them, how you started and, your background and everything coming into medicine?
Yeah. So I am Dr. Elizabeth Sage Epstein. I'm an integrative cardiology fellow, finishing up my fellowship in June, and I'll be an integrative cardiologist after that here in San Diego.
Love it.
Not the main thing about me. There's so many pieces to the puzzle.
Of course.
Other pieces about me. I'm a wife, a daughter, a friend. I live near the ocean. I love being outside. Don't like swimming in it or surfing in it. But I like horses. I like cooking. I like baking. And
oh my gosh.
I like interior design.
You really do. I mean, this house is beautiful. I couldn't stop, acknowledging that. But wow, I mean, just a beautiful soul, beautiful energy. I love your journey here. And,
You.
Yeah, and a lot of Liz and I share a lot of the same passions in life. Life is more than just your career. Of course, medicine to me seemed almost like a natural path in some ways. Both my parents were doctors, and they always inspired me just by living out their lives and seeing how much they loved medicine. They never pushed me into it, luckily, but witnessing that at a young age and seeing the passion they had instilled that passion in me. And so I always wanted to help people. I always recognized, the privilege I had growing up and wanting to pass that on. And so, that's a big reason I came into medicine, and then, discovered integrative while when I came here to San Diego for residency. That has really inspired me. I had no idea, what this field was formally. I just knew, that when I focused on things like sleep and, mindfulness and my diet, I felt better. I felt more present. I felt more engaged with what I was doing. I felt more empowered. And so, when I met Liz, my first year of residency, when she was a first year fellow, I just saw her passion for integrative, and it inspired me to dive more deeply into this. And so now, I'm a third year resident finishing up in about 6 months or so, and pursuing an integrative fellowship and working in primary care with the underserved, and being inspired to pursue global health opportunities as I have throughout my life already. And on top of that, I am a runner. I'm a baker. I'm a cook. I'm into photography. I'm into video making. What else? I like to wear a lot of hats, and I don't like to define myself.
The more hats, the more rich the life is.
Yeah, that's right. I am someone that loves the idea of not fitting into a box. Right. Today I'm sitting down with a huge role model and friend, and I get to be a podcaster. And I will say a big part of my life is finding a home here in San Diego. I've never felt so connected to a city, and all my friends who know me always.
You don't care how expensive it is. It's worth it.
I do care, but I will say that the expense inspires me. It's like, okay, you're gonna pay that much to be in a place, like you better bring your game, and I feel like it brings that energy out of everyone who's here, like
connectedness.
It's super connected. It's very palatable, the energy here. I just, everywhere I go, people are, I can tell, just
positive,
doing what they love, really feeling like they're growing as people in the ways they want, and just embracing what matters. So,
and I think Kunal and I came to this really organically. We were working together on a busy inpatient cardiology service, and me, being very inquisitive, started just probing, asking some questions about Kunal's life.
Is that what happened?
Yeah.
I probably probed as well. I feel like we probably.
I for sure started it because you were going on a trip.
Okay.
Where were you going? It was at the end of your first year. And I said...
To Argentina or Japan? Well,
I think to Argentina.
Okay.
I started asking about it. Who are you going with? What brought you here? I'm like, how did this guy from Duke come on over to Scripps and La Jolla? And then I got your whole life story basically up to that point, and this incredible transformation that had just occurred in your life that year. And I think that was probably the first step to us becoming like connected and close friends.
Definitely. It is vulnerability, I've discovered. When you are able to ask those questions, spend time with someone, and open up about, your life in a way that it's something you might not commonly share always, but you're open and you're vulnerable. Yeah. It's like this sense of trust, and it is an expression of love in a way. It's like allowing someone into your life and seeing the experiences you've had and you've gone through, and reflecting on how it's changed you. And then I feel like that inspired you to open up to me about things you've gone through, and get to feel this connection that we had.
So hopefully we'll bring some of that organic discussion to this podcast, and I think we'll have a lot of fun.
We could talk all day. And so, that's going to be an important part of this podcast, is bringing our energy, what drew us here naturally and to each other naturally. It just was a perfect fit for us to come and talk. And, if we can, help at least even just one person listening and ask questions, that's really what it comes down to, is we just ask a lot of questions. And, we've met so many wonderful people that have helped inspire us and helped us answer those questions as best as we can. So, what a gift for us to get to share that.
We're really excited to dive into these things, maybe even have some amazing guests, mentors that we have, just to every time talk about one thing with data that can prolong your life.
The younger you start, the more improvement and benefit this can have on you, So And
medicine in the past hasn't been as focused on prevention.
Yeah.
It was let's put out the fire once it's already raging.
Exactly.
And treat really aggressively. And
Yeah.
our mindset is let's deal with things way before, 30 years ahead, when there's little signs of trouble that we could find with a magnifying glass and start to treat.
Yeah.
The upstream causes of disease that could cause suffering and death later in life.
That's right.
So we're changing our mindset in medicine. It's actually still a frontier.
I love to talk to physicians in the hospital, my mentors who have no experience with integrative, but we find ourselves just naturally talking about, man, like I feel like we could be doing something better here, but I don't know what. And then when we naturally just dive a little deeper into that conversation, it becomes almost like clockwork that we end up on an integrative topic that they have anecdotal experience with, that I definitely do. And then we, find some studies that are just like, man, you know what? Like there's something here.
Yeah. And like we said, audience can be young because the earlier you start, the better.
Yeah.
Tiny drop in your cholesterol early in life, but maintained for decades, is going to have a mortality benefit. It's going to make you live longer. But it's also never too late to make lifestyle changes. So I think older people can also benefit from this. And there's data that we'll probably go through later to show that even making these changes later in life still provides a benefit.
That's right. And so whoever you are, and wherever you come from, whatever your background,
wherever you're at.
Yeah. Wherever you're at, physically, mentally, whatever journey you're on, we want to help you progress in every way you can. If we can catalyze some steps for you on your journey in a sustainable way, in an economical way, I mean, come on, that's awesome.
Well, we hope you'll join us on this journey. I'm really excited. What's our next topic we're going to talk about?
I'm very excited. Our next topic will be diet, and we'll get into all the specifics and things to think about with diet. The biggest thing is there's no quick fixes with diet.
Wouldn't you want a magic bullet medication that can reduce your risk of heart attack, stroke, or death by 30%? Absolutely. And it turns out that we are actually eating, at least probably 3 times a day. And that is a medication it's better than any medication we have. So just imagine putting food in your mouth for your entire lifetime as a medication. So we're going to talk about the evidence-based dietary practices that can make you live longer.
Honestly, that's such a good point to emphasize about every potential topic we discuss is, just reconceptualize the way we think about medicine. Food is a medicine that we take 3 times a day. Yeah. Exercise is a medicine. If you put all of the benefits of exercise into a pill you took every day, it would be the fastest selling pill of all time.
Yeah. Exactly. And it's all empowering things that you already have and that you can make a huge impact in your life. So thank you so much for joining us.
Yeah, thanks so much.
We are super excited to move forward.
So excited. Hell yeah. Awesome.